Welcome to the deep dive. Today we're looking at something seemingly basic, but really vital, the liver blood test. And we're basing this on the guide from Blood Test UK, which is actually aimed right at the Bloxwich community and the wider West Midlands too.
That's right. Our goal today is pretty simple. Take the medical jargon and make it, useful knowledge for everyone. And we're focusing on this area because, as the Blood Test UK info suggests, certain lifestyle factors there might mean liver issues are a bit more of a concern. So being proactive is key.
Right, that local angle is important. So talking about being proactive, what's the number one reason, in simple terms, someone listening should care about these tests, even if they feel fine?
It really comes down to early detection. Liver problems often don't show symptoms until there's significant damage, maybe even cirrhosis. These tests, they find problems early. That means treatment can start much sooner when it's way more effective.
Okay, early detection, got it. But what else? Does it help with day-to-day health beyond just spotting big diseases?
Oh, absolutely. It gives you real data on how your body's working. Think about it. These tests can show how things like alcohol or even some medications you might be taking long-term are affecting your liver right now.
So it's not just about disease, but about current impact.
Exactly. And seeing those numbers can really, encourage healthier choices, maybe changes to diet or exercise. It's about managing your health actively, especially as Blood Test UK points out for the West Midlands. If things like obesity might be a factor, this kind of check is really your first line of defense against things like fatty liver disease.
Okay, so let's get into the specifics. The Blood Test UK guide mentions 4 main things these tests look for. Can you break those down simply? What are they actually telling us?
Yeah, think of them as warning lights on your liver's dashboard. First up, you've got ALT and AST.
ALT and AST, what do those stand for, roughly?
Well, ALT is Alanine Aminotransferase. AST is Aspartate Aminotransferase. They're enzymes. Basically, if liver cells get damaged or injured, maybe from too much fat or toxins, they release these enzymes into your blood.
So if ALT and AST levels are high, that's a direct sign the liver cells are stressed or hurt.
Precisely. High levels are a clear signal of cell damage. And for the kind of risks mentioned in the Bloxwich area data, checking these two is probably the most critical step for catching something like fatty liver disease early, when it's often reversible.
Okay, that makes sense. What about the next one? ALP. Does that signal the same kind of damage?
No, ALP, that's alkaline phosphatase, usually points to a different kind of issue. It often goes up if there's a blockage somewhere in the bile ducts, the little tubes that drain the liver.
A blockage? Like gallstones, maybe?
Could be gallstones or other things blocking those ducts. So a high ALP tells doctors to investigate that possibility. It's more about flow, less about direct cell injury, like Altist.
Got it. And the last one the guide mentions is bilirubin. I think most people connect that with jaundice, right? Yellow skin.
That's the one. Bilirubin is basically waste that comes from breaking down old red blood cells. A healthy liver processes it and gets rid of it. If your bilirubin level is high, it means the liver's struggling with that cleanup job. It can't process the waste efficiently, and that buildup is what can cause the yellowing of the skin and eyes jaundice.
So putting all this together, what's the main takeaway for someone listening, maybe someone in Bloxwich or nearby? The Blood Test UK material quotes a Dr. Sarah Thompson.
Yes, Dr. Thompson emphasizes just how vital this is. She says, and I'm quoting here, "Early detection through blood testing can significantly enhance treatment options and improve patient outcomes." It's pretty direct.
It really is. It sounds like knowing your numbers isn't just a one-off thing.
Not at all. Regular testing builds up your personal health picture over time. You get a baseline. And connecting that back, knowing your own normal levels helps you and your doctor manage those long-term risks. We talked about things linked to obesity, maybe heavy alcohol use, or even past viral infections, which are noted as factors in the West Midlands. It shifts you from just reacting to problems to actively reducing your risk.
Right, it puts you more in control. The sources are pretty clear that lifestyle plays a big role here. So here's something to think about. If you actually knew your specific ALT or AST numbers from a Blood Test UK test, how might that knowledge actually motivate you right now to make a small tweak to your diet? Or add a bit more exercise? Simple changes that could protect your body's main filter from damage you might not even feel yet. Might be something worth asking your GP about.